Hi and welcome to Global Nurse Mentor. In our last video, we studied about dose calculation for the tablets and for injections. Let's roll the scenario in this video. What if your doctor prescribes IV fluid through drip set and you don't know how to calculate the drop rate? Don't get nervous. In this video, we are going to break the drop calculation step by step and make it easy for you.
So before starting the drop rate calculation or the infusion rate calculation, let's understand the basic terminology which we are going to use in the practice questions. The first thing is infusion. So infusions means the fluid or the medication which we are administering to the bloodstream. Okay, so the next one is the drop factor. The drop factor tell you how many drops will make 1 ml of the fluid. So it depends on which IV set we are using for our infusion. Suppose we are using the macrodrip set. So in macrodrip set, the usual amount of drops per ml is either 10 ml or 15 ml or 20 ml, which depends on the diameter of the needle which we are using in the chamber. For the microdrip set, which we commonly use in the pediatric sets, the drop rate is 60 gate per ml. Gate is nothing but the Latin word for drop. So the common drop factors would be printed on the IV tubing package, which I said can be 10 drops per ml, 15, 20, 60 depending on the diameter. The next terminology is infusion rate. Infusion rate tell us how fast the IV fluid is running. That means number of drops per minute. And another thing is, what is drop rate factor? Drop rate factor, also called the drop factor, is the number of drops, that is gate, that equals to 1 ml of the IV fluid. So in macro drip set, if the drip set says the drop rate is 15 gate per minute per ml, that means 15 drops are going to make 1 ml. So in this chamber, 15 drops which are kind of falling into the chamber would make 1 ml. So now when we know the terminology, let's switch to the practice question. So in this question, the healthcare provider prescribes 1000 ml of 0.9% normal saline to infuse over 8 hours. The IV tubing has a drop factor of 15 drops per ml. So let's see what is given in this equation. So the volume is 1000 ml here. The time over which this fluid or this volume is to administer is 8 hours, and the drop factor is 15 gate per ml. So what does the formula say? The formula says the volume should be in ml, multiply by drip factor or the drop factor, divided by time in minute. So here our volume is already in ml, so we need not to convert this into the further dimension. The time is in 8 hours, so the time should be in minutes. How do we change the time from hours into minutes? So 1 hour is equals to 60 minutes. 8 hours is equal to 60 into 8, which is 480 minutes. So the time is 480 minutes. So let's go to the formula. The volume is 1000 ml into drop factor is 15 divided by time in minute is 480. So it will become 31.2, which is approximately 31 drops. So the answer is the infusion rate should be 31 gate or drops in 1 minute. So we are going to set our drip set in a way that the chamber should throw 31 drops in 1 minute. So this was the simple or the basic example. Let's switch to the other tricky one. So what is the question here? The healthcare provider orders 2 units of packed red blood cells, which is PRBCs, 250 ml each to infuse over 6 hours. The IV tubing has a drop factor of 20 Gauté per ml. How many drops per minute should the nurse regulate the IV to deliver the blood as prescribed? So let's see what is given here. The volume is 250 ml. Is it 250 ml? So see, this is trick here. 2 units. So we have 2 units of PRBCs, which is 250 ml each, to be given over 6 hours. So the volume is not 250 ml. This is 250 plus 250 because we have 2 units of packed RBCs which we are going to deliver over 6 hours. So 250 plus 250 will make 500 ml. So our volume here is 500 ml and not 250 ml. Okay, and the time is 6 hours, but we know we need the time in minutes. So 6 into 60 is equal to 360 minutes. So what does the formula say? Is the volume in ml drip factor into drip factor divided by time in minutes. So let's plug it into the formula. Volume is 500 ml into drip factor is 20 Gauté per ml divided by time, which is 360 minutes. So it will become divided by 360, 1000 over 36. It is 27.7, which is approximately 28 drops per minute. So our answer is 28 drops per minute. Let's do the final question. The question says the healthcare provider orders 0.75 liter of Ringer lactate solution to be infused over 95 minutes. The drop factor is 20 Gauté per ml. How many drops per minute should the nurse regulate the IV to deliver? So let's see what is given here. The total volume is 0.75 liter, the time is 95 minutes and the drop factor is 20 Gauté per ml. So our volume is in liter, but as per formula, the volume should be in ml. So how do we convert the liter into ml? We know that 1 liter is equals to 1000 ml. So 0.75 liter is 0.75 into 1000, which is 750 ml. So now we know that our volume in ml is 750 ml. The time is already in minutes, which is 95 minutes, and the drip factor is 20 Gauté per ml. Let's put it into the formula now. So our volume is 750 ml into the drip factor is 20 Gauté per ml and the time is 95 minutes. So this will become 15,000 divided by 95, which is 157.9 Gauté per minute. So let's round off, 158 drops or Gauté per minute. So our answer is 158 drops per minute.
So I hope the drop calculation is much more easier now. So if you found the video helpful, like the video and subscribe the channel because that gives us motivation to make more such videos. Thank you.